Assalamualaikum. Now I'm going to present a paper that was prepared by Nurul Haziqah and Prof. Dr. Saud Dahwo, entitled The Effects of Obesity Information on IIUM Students' Health Practices. The background of the study: as we all know, obesity is one of the common health problems in modern living. According to World Population Review 2020, there are approximately 2.1 billion people in the world that suffer from obesity. Obesity has become the main concern for health ministries, health organizations, non-profit organizations in many countries in the world, including Malaysia. This can be seen whereby there are many obesity-related information that are available in the new media and, of course, in the mass media. The problem statement of this research study: for the past 3 decades, Malaysia has become the fattest country in Asia, whereby most of the Malaysian adults are overweight or obese. Not many research has been done in determining as to whether or not Malaysians are taking the precautionary steps to avoid being obese. This is where this research study wants to explore the health practices of IIUM students after they have encountered with obesity-related information through mass media, new media, and interpersonal relationship. There are 3 research objectives for the research study. The first one is to find out the level of IIUM students' exposure to obesity, perceived susceptibility to obesity, perceived severity to obesity, perceived benefits to obesity, and perceived barrier to obesity. To find out the level of health practices among IIUM students and to define the relationship between exposure to obesity, perceived susceptibility, perceived severity, perceived benefits, and perceived barriers on obesity-related information with IIUM students' health practices. As for the significance of the study, the findings of this study will contribute to a greater body of knowledge on obesity in Malaysia, specifically for university students. This paper is also useful for public that seeks knowledge about obesity, and for future researchers, health belief model is the research theory or model that is going to use in this study. It is known that not many researchers in Malaysia employed this model in their research. Next, literature review. The first one is health communication. Sixman et al. 2014 defined health communication as the study and use of communication strategies in informing and influencing public decision and action that can improve health. It includes health promotion, health protection, disease prevention, and treatment. Next one is obesity. According to World Health Organization WHO 2020, obesity is an unusual or excessive fat accumulation that can damage one's health. Malaysia is the #1 country that has a high percentage of people who suffered from obesity. Next, obesity-related information. There are many types of obesity-related information that are available online and offline, such as symptoms of obesity, causes of obesity, treatments for obesity, and many more. The last one is theoretical framework for this research study, and health belief model was being used. Health belief model was developed by social scientists in 1950s at the US Public Health Service. This is a tool whereby scientists use to predict health behaviors. The model says that a person willing to change his or her behavior due to several factors, which are perceived susceptibility, perceived severity, perceived benefits, and perceived barriers. For conceptual framework, there are 5 independent variables and 1 dependent variable for this study. For hypothesis, there are 5 hypotheses for this research study. The first one is there is a positive relationship between exposure to obesity-related information and IIM students' health practices. Number 2, there is a positive relationship between perceived susceptibility towards obesity and IIM students' health practices. Number 3, there is a positive relationship between perceived severity towards obesity and IIM students' health practices. Number 4, there is a positive relationship between perceived benefits of actions towards obesity and IIM students' health practices. And the number 5, there is a positive relationship between perceived barriers towards actions against obesity and IIM students' health practices. Next, the methodology of the study. Quantitative research design was being employed for the participants, IIM students in Gombak campus. For the sampling technique, network sampling or snowball sampling was being used because this research study was conducted in the midst of COVID-19 pandemic, and this research study used questionnaire as the instrument. Next, the findings of this research study. Overall, from 212 respondents, majority of them are females, 60.8%, and most of them aged between 21 to 25 years old. It is also indicated that the respondents had their foundation and degree studies and furthering their studies in IIUM. The study also revealed that some of the respondents are overweight and obese. Next, one sample t-test for exposure to obesity-related information. Overall, majority of the respondents, 59.7%, reported that they are not exposed to obesity-related information. This also showed a negative and insignificant t-value, negative 0.235 with mean 2.986. Hence, it can be said that these findings indicate that the respondents has low level of exposure to obesity-related information and is answered on the negative. Next, one sample t-test for perceived susceptibility towards obesity. Overall, majority of the respondents, 54.2%, believe that they are not susceptible towards obesity after being exposed to obesity-related information with a negative and significant t-value, negative 3.596 and with a mean of 2.708. The results prove that the levels of perceived susceptibility towards obesity are low among students in IIUM, thus it is also answered on the negative. Next, one sample t-test for perceived severity towards obesity. On average, 7 in 10, 72.3% of respondents think that obesity is a very dangerous disease after being exposed to obesity-related information, with t-value 9.085 with mean of 3.613. The results show that IIUM students have positive level of perceived severity towards obesity, thereby answering the research objective of the study. Next is the one sample t-test for perceived benefits for taking actions towards obesity. This indicates that the respondents' views on the benefits for taking actions towards obesity are significantly positive, 79.2%, with the overall mean as 3.960 with t-value 16.807. All in all, it can say that students in IIUM tend to perceive more benefits in taking actions towards obesity. Hence, the results indicate that they have high level of perceived benefits for taking actions towards obesity. Thus, this would support the research objectives of the study. Next is the one sample t-test for perceived barriers towards actions against obesity. The findings indicate that half of the respondents, 56.5%, believe that they tend to encounter problems while taking actions against obesity, whereby the t-value is negative 2.541 with mean of 2.826. It can be concluded that the respondents has low level of perceived barriers towards actions against obesity, and this do not support the research objective of the study. The last one is one sample t-test for health practices. As has been shown, on average, 7 in 10 of the respondents, 73%, have a high levels of health practices with t-value 10.589 with a mean of 3.649. These results prove that IIUM students have positive responses towards practicing healthy lifestyle to prevent obesity after being exposed to obesity-related information, therefore answering the research objective 3. Next is the hypothesis testing. The first one is there is a weak and positive relationship between exposure to obesity-related information and students' health practices, whereby the R value is 0.332 and P value is 0.000, hence H1 is accepted. There is a negligible and positive relationship between perceived susceptibility towards obesity and students' health practices, whereby the R value is 0.147 and P value 0.032, hence H2 is accepted. There is a moderate and significant positive relationship between perceived severity towards obesity and students' health practices, whereby the R value is 0.456 and P value 0.000, hence H3 is accepted. There is also a moderate and significant positive relationship between perceived benefits for taking actions towards obesity and students' health practices, whereby the R value is 0.587 and the P value 0.000, hence H4 is accepted. However, there is no relationship between perceived barriers towards actions against obesity and students' health practices, whereby the R value is 0.031 and the P value 0.650. Hence, H5 is not accepted. Next, the discussion and conclusion. A total of 212 students from 7 different Kuliah IIUM Gombak voluntarily participated in the study. Overall, students do practice a healthy lifestyle in a way to prevent obesity after being exposed to obesity-related information. The first and second research objectives being answered and 3 variables emerged positively rated and other 3 variables emerged negatively rated. And it can be said that the findings of the study support the health billing model. This is where the students will tend to change their health practices after being exposed to external stimuli. As for the limitations of the study, this study was conducted when Malaysia had enforced an MCO during COVID-19 pandemic, hence it called for an online survey method. For suggestion, For future research, the first one is to make a comparative on gender, race, age, income, residential area, and locality, to use other variables not included in health belief model, and to focus on the effects of media on Malaysian food consumption leading to obesity. That is all for me. Thank you.